Working with kids is enjoyable by itself because they are so full of energy and joy, and that in a way gives you energy and joy and makes your job very fulfilling. When I first meet the patient, I get to know their social structure. I get to know their parents, their grandparents, their sometimes family member, cousin, relative, or even the neighbor that may bring the child to see me. And I need to understand, obviously, what is the main concern and what is it that I'm trying to correct. It's important to also be accessible. It's also important to give them avenues where they can reach you, whether it be by email or whether by cell phone or obviously after hours phone calls. When they do see us for a deformity or for a concern, I hope that they're able to expect from us the latest in technology and latest in intervention. So sometimes the treatment options can be 1, 2, 3, or 4, and know that we are able to offer all 4 treatments, but only number 2 or number 3 is appropriate for their child. So knowing that we can offer those options laid on the table, and then we collectively can decide on what is appropriate for their child. When you have a child that's injured, has a growth plate abnormality, has a congenital difference that is very particular to their age group, seeing a pediatric orthopedic surgeon rather than general orthopedics is critical. We are able to understand, obviously, the fragility of the things that we do to them now, and we're able to guesstimate and predict what will happen to them in the future over the next 20, 30, 40, 50 years. So the procedures that we do are quite specialized to affect them specifically, and the training that we have is specialized for pediatrics. You actually respect the fragility of the child, and the procedures that you do are so specialized and so honed in that you can correct their deformity now and give them a lifetime or a future of many, many years of improved health. So what you do now affects them not just 10 years from now or 15 years from now, but literally 60, 70, 80 years from now. So that's what's beautiful about it. This is a frame that I would place on your child's leg. So it's transfixed to the bone with pins. And then there are dials, 1, 2, 3, 4, 5, 6, all the way around. So I would give you a schedule, and then you would take it at home. And every single day, you would turn these knobs based on that schedule. And then over time, as you rotate these, the leg will go from crooked to straight. So this is an internal lengthening device that I would put inside your thigh bone, your femur. And so it's placed through a small incision through the hip, and it's placed inside the bone, and the bone is broken. And once the bone is broken, then we would use a remote controller at home, and you would lengthen the leg. And by lengthening the leg like this, it would make your bone straighter and longer. So this is a real patient. So this girl obviously had a very severe deformity, and she had a lot of rotation, and her spine was like really twisted. So we sent it to a company to print it out as a 3D model. And the ability to do that is obviously you can take it to the operating room and you can base your surgery based on that. You can pre-drill the areas where you're going to put your screws in so that it'll make the job easy. I truly try to follow the motto of we never really grow up, we just learn how to act in public. So I think keeping that approach and working with kids and being able to kind of be jovial and fun and really get down on your knees and meet that child eye to eye is really what sets you apart.